approach within the hospital is, so I know that the answer is going to be it depends. That's a little bit dependent on the technology, but maybe to frame the conversation up a bit more, should you be speaking with the user, or should you be speaking with the individual who has the budget and the pocketbook?
Or who answers their phone?
I would say the user to start. And I wouldn't say necessarily going through, an org chart or looking at the directory, but more looking at PR, looking at the news. Who's been out there speaking about something? Who's been out there doing, say for us, disease management? So say you're in the predictive analytics space, say you're in the patient connectivity space. Disease management is all about that. That's about looking at the patient and managing their care when they're outside of our four walls, and forming relationships with our physicians, the double practitioners, and the law. That's someone who's going to be very interested in the pilot, and someone who's going to be speaking to it internally. They can convince the budget person at least to listen to it from there, and that's when you're in the door, and that's the biggest hurdle to overcome. So look for those non-traditional sources. We're all connected. People have LinkedIn profiles, Facebook profiles. They post things up all the time, especially if it's something they're interested to, and that can be a good thing to follow up.
And the follow-up for Vishal and Joseph, so maybe in the context of your specific solutions, maybe you can talk about who the user typically is, who the payer typically is, and how did that kind of play out in terms of the series of dialogues that you had with the organizations you were working with?
So for us, the best thing that ever happened was the development of patient experience departments. So it's easy. That's what they do. They try to improve the patient experience, and that's what we do. So for us, it's been very easy. We've been fortunate that probably half of our pilots were from inbound leads, people calling us and wanting to do something. Probably the other half are from us having just casual conversations, and those becoming leads. And those conversations have been with anybody in that department. Anybody within that hospital, even if it's just some cardiologist, and we want to do something with the orthopedic department. Everybody sort of gets it, and then they just put us in touch with the right people, and that handshake or warm lead is all it takes. And if they're not interested, then we move on. We don't want to badger anybody, but it's just getting your foot in the door. We do use social media to develop some relationships. Those people, we're in the tech space here, so the people that are out in front on social media tend to be a little bit more of the early adopter crowd as well. So that does help. Oh, I forgot the second part of that question.
So the second question, I think, was, unless you had anything to add on the topic of sort of user and address that.
Not really. If your user is different from you, the person who's paying, then you should be talking to both of them probably simultaneously.
So the second question was from a policy perspective. Make sure I'm articulating this correctly. From a policy perspective, where are there opportunities to grease the skids for entrepreneurs, be it changes in allowable reimbursements, which would be potentially one lever, to force interoperability standards, to integration. But given kind of the day-to-day work that all of you are up to, where do you see the potential points of leverage that would really help to accelerate the extent of innovation and activity in the healthcare space? Is that a fair characterization?
You said it better than I did. Thank you.
So the way I see it, our job is to innovate around whatever policies are out there, whether they're good or terrible. So even terrible policies create an opportunity for us. So whatever you see as becoming changes in healthcare, whether you see the Accountable Care Act as a good thing or a bad thing, it gives us the ability to innovate around that. And there are companies to be made. So in terms of healthcare policy, I think we can operate it. We can sort of hedge whether it goes up or down. In terms of helping us as young startups, I think that comes from within. I think that comes from events like this, and from what Subu was trying to do. I think that is really what I could have used and could still use, is putting together sort of a speed dating meet and greet between hospitals and startups and let us all get in a room and have 2 minutes of conversation each, that would jumpstart. I mean, that takes 3 months of work and puts it into 1 day. That's what I could use. But the policies I can work around, and I can create companies